There's a province in China with 750,000 men under 65 without any heart attacks because they eat a diet that doesn't create any plaque. Can you tell us more about this?
The county is Guizhou County, and this was discovered in the China study by Dr. Campbell. And in this county, the people eat plants. The only animal food that ever touches them is a little bit of lard used to keep their pans greasy or their woks greasy. They use a tiny amount of that. Because they eat only plant food and their saturated fat is low, their cholesterol is low, their arteries are clear, and you simply can't get an ischemic heart attack unless you have arterial clogging, which they don't. So none of them had it. The equivalent for America would be hundreds of men getting heart attacks because of the way we eat here. Now, are Chinese people immune to heart attacks? Not at all. In the cities in China, where they eat higher saturated fat diets and where you can find these things, they get heart attacks like everybody else.
What does the science say about the effectiveness of cholesterol-lowering drugs on preventing heart attacks and death? And what are the side effects of the drugs?
Statins do reduce blood cholesterol. And the proper way for people to get rid of statins is to eat a plant diet that's low in saturated fat, get a blood test, take it to the doctor and say, look, my cholesterol's really gone down. Can I cut my statin dose down? And perhaps a doctor will say, okay, we'll go to half dose. And the next test they get, they'll say, look, my cholesterol's even lower. And he'll say, it's even lower? Well, you don't need the statins anymore. Now, what statins are hydroxymethylglutarate, coenzyme A reductase inhibitors. And what they do is they stop the production of mevalonate and farnesyl in the body. Now, this stops the production of both cholesterol and coenzyme Q10. The cholesterol production, of course, is desirable in the body unless you're having external sources. And the coenzyme Q10 is a vital part of our body, absolutely necessary for energy production and the only fat-soluble antioxidant that humans make. 40% reduction by the average statin user. And this can result in side effects of rhabdomyolysis, a muscle disease in some people who take it, aches and pains, lack of energy. There are a lot of side effects to statins. So I encourage anyone taking statins to use this approach to go to a whole plant diet, lower your cholesterol until your doctor refuses to prescribe you any more statins, and then you're done with them.
And muscle deterioration over time?
Yes, that is one of the side effects.
Mitochondrial dysfunction?
Well, that's the mitochondrial dysfunction is from the lack of coenzyme Q10. Now, it would be good if everyone who took statins also took coenzyme Q10, which we use in our study, and it is very safe and naturally produced in our bodies. We do produce a little less as we get older. In our study, the Hawaii Dementia Prevention Trial, we had people take 200 milligrams a day of the ubiquinol form of coenzyme Q10. However, dietary coenzyme Q10 has a tough time getting into the cells, into the mitochondria where it's needed, where the statins are interrupting the ability of our bodies to make it. So it would really be better if people can lower their cholesterol enough to where they don't need statins.
You mentioned unequivocally earlier the correlation of cholesterol to heart attacks and stroke. What else can we do to prevent them?
To prevent heart attacks and stroke, well, you know, stress is a big factor, and you can do a lot about de-stressing yourself. Exercise is a huge factor. Steady, regular aerobics, but be careful. Start slowly, very gradually increase your aerobic, and make sure that your doctor or another professional is giving you a target range. For me, at my age, it's 120 to 140 is my pulse rate. That's my target range. If I go over 140, I start breathing too hard. If I go under 120, I stop breathing hard at all. And that's my aerobic range. So make sure you get a target zone in there. Also, of course, anti-inflammatories and antioxidants are crucial for preventing atherosclerotic plaque because of the inflammation and the oxidative damage that really make it worse. So the LDL is a transporter. It's made in the liver first as VLDL, very low density lipoprotein. As it circulates, the triglycerides are pulled from it as it docks to LDL receptors throughout the body, and they pull out the triglycerides. Unfortunately, if it gets oxidized because we're not getting enough vitamin E, for instance, and other antioxidants, then it can damage the signaling recognition protein, the apolipoproteins as they're called, and it no longer can dock and get its contents taken out. So it circulates until it's more oxidized and sticks to the inside of a cell and becomes atherosclerotic plaque.
My simple answer to that question is to help people prevent getting strokes and heart attacks. Start experimenting with different fruits and vegetables at the grocery store. Start experimenting with cooking different grains. It's just a matter of how much water and time is needed to cook them. They're wonderful. Start experimenting with recipes in different whole food cookbooks and start little by little pulling yourself away from the processed foods and the foods in the middle of the grocery stores that are going to be providing you with too much saturated fat and leading you down the wrong road. I call those foods false friends. They pretend they're going to make you healthy, but in general, they're going to make you sick in the long run. So it's a long journey, but you can start today with experimenting with just one different fruit or vegetable and take the first step towards a healthier tomorrow.
Tell us about the 2018 large prospective study in China that found that vitamin C reduced the risk of stroke by 54%.
Yes, this was in the Journal of Epidemiology Community Health, a 2018 study. There are 948 people in the study, and it ran for 16 years. What I like about the study is that they looked at vitamin C in plasma and didn't just rely upon food frequency questionnaires, because people aren't always that accurate. And it did reduce the frequency of cardiovascular disease 59% and the stroke 54%. So in other words, it more than cut in half the incidence of these deadly problems just by having enough vitamin C. Now, vitamin C is often seen as a marker for the intake of fruits and vegetables, which have many compounds which are very protective of heart disease. However, in this study, they found that supplements that raise plasma, vitamin C, also work just as well. So it's a good idea to keep that vitamin C flowing into your body, perhaps through both routes.
That's a meta-study?
No, that's an actual clinical trial that ran so long with so many people.
Oh, great, great.
When are you for pharmaceutical drugs and when are you against them?
As author of Mosby's Drug Guide for Nurses, 4th edition, co-author on that book, I will say that I have explored the uses of pharmaceutical drugs quite in depth, and I am very much for pharmaceutical drugs when they're necessary. My goal is to make the pharmaceutical drugs kind of like the Maytag man, who, if the machines never break, he's never doing anything. I would like to make it so that people don't need them. But when they're necessary, such as in an emergency room, I think they're absolutely necessary. And like I said, with statins, they're needed to reduce cholesterol down to a reasonable level, but then we can get off the statins by eating a whole plant diet and having our doctor say you don't need these anymore. So when drugs are necessary, I think that's fine, and it's life-saving, and we're very grateful to have them in our lives. Perhaps it's not the right idea that our modern medical system, their first choice for any problem is medication. The first choice might be, in my book, if something is not acute, if it's not very urgent, that perhaps there's other things we can do. For instance, for convalescent care, drugs might not be the first choice. Perhaps herbs could be a good choice there. Something gentle and effective that will help us over a long period of time. Unfortunately, our medical system is really geared toward medication. I think they are overused.
In a clinic, in the neuroscience clinic that we worked in, we saw that people became addicted to the drugs. They had to use them for the rest of their lives. And in many cases, the medical doctors did not see any other options. So that was rather disturbing to see. I understand that that's what they do and that's what they're experts in. And I could see the benefits in the patients. But if we can dial up the health of the patients to where they can take care of the problem with their own bodies and not rely on the drugs, little by little, with their doctors overseeing dosage use, then that is an ideal way to go. Now, Steve and I met over 30 years ago where we were both really, I'd say, experts in herbal medicine. and he wrote the Herb Doctor's CD on herbal medicine.
The herb doctors have actually been working on for over 35 years now.
It's gotten bigger.
From 54 countries and regions worldwide, I have read herb books and put every bit of knowledge into this database to the point where there are now 168,000 footnoted references. And what I do is it automatically correlates it so that you can see where the top people in the world agree on the use of these plants for various illnesses, virtually every illness you could get. But I want to amplify that. For instance, for diabetes, yes, there are drugs like metformin that are routinely given for diabetes. However, there's another approach. And many doctors like Neil Barnard and Terry Shintani, these people have done trials where people are reversing their diabetes in a matter of weeks with a change in diet. So there might be another way to treat these things rather than just using medication. But it does take more time and trouble than a 15-minute prescription writing session with a doctor in order to get the real scoop on how to reverse diabetes. I do have a book called Diabetes Breakthrough, The Key to Insulin Resistance. It's my latest book, and it talks about how to reduce insulin resistance rather than just working on all the carbohydrate going in. You have to look at how the sugars get out of the bloodstream and into the cells where they're needed. And the way to do this is to gain more insulin sensitivity, and this can be done principally with lowering saturated fat.
I want to back up one step, please. With the allopathic medicine, the treatment for the disease, we found that the herbal applications were often used in a similar way. Oh, you have this problem, let's give you something to relieve it. And in many cases they did, which was fantastic. But as Steve has said in an earlier date, it's difficult to overcome pounds of wrong food with ounces of herbal medicine, or even grams of allopathic chemical drug medicine. So it is the food that really can make the stronger difference in our lives in the long run. So although we love the herbal medicine, we've switched over pretty much to how the food can be especially medicinal.
By the way, this is my latest book, Diabetes Breakthrough. If you need help, you can get the download for under $10 on my website, drsteveblake.com.